I believe that health can bring people together. And I believe that a pursuit of better health can be a unifying force in healthcare. When you look at the healthcare landscape these days, people are so divided. I mean, people are divided in our society in so many ways, but health is one of the big things that people argue, and people have even hatred with each other about health or health care. But when you dive into it, it isn't even health care. It's healthcare policy, and as much as anything, health economics. How do we pay for healthcare? And I think we need to try to bring this down to a root level that is below health policy and health economics to actual health. We are all human beings, and we all have human bodies that need the same things. We're ultimately the same. And if we can bring it down to this level, I think we can really move health forward. You know, when you look across a spectrum, you say, okay, someone on the hard right says, well, I want the government completely out of healthcare. And someone on the hard left says, you know, I want to shut down all private insurance and nationalize the system. You know, and we have this whole landscape of opinions. But how many people who are pouring their efforts into healthcare reform are actually themselves unhealthy? And so I want to issue a challenge. If you want to help really reform healthcare in America, let's bring it down to ourselves. Let's get ourselves as healthy as possible. And as we focus on our own health, all of us together, and we build out the systems and practices that help us do that, I have to tell you, the economics, however it plays out, you know, I don't have the answer to that, but the economics are going to be better in any fashion, no matter who is paying for it, when more people are experiencing more health. And this is one of the reasons why I get so optimistic about health in our country and going forward, because there does not have to be a political solution to this. There does not have to be an economic solution. There's a personal solution that the healthcare system, this is what it should be focused on. How do we help as many people to be as healthy as possible? And then this is something that we can get excited about, that can bring people together and say, despite our differences, despite our different opinions on any number of things, can we focus, all of us together, on helping our fellow human beings to be as healthy as possible? And there are three primary things that I focus on that I want to share with you. The first is eating healthy food. Everybody recognizes this. This is not controversial. You know, there's no left or right on, you know, should we eat healthy food? Of course, we should minimize our consumption of processed foods, focus on core nutrition that brings health to the body. It's not controversial, right? And we should move our bodies in healthy ways. This is not controversial. It's so healthy. Move our bodies in healthy ways. Get outside in the fresh air. And then the thing that I focus on that I think is really a revolutionary practice for our society, to embrace open, food-free space. That's a fasting space. Nobody has to fast. If anybody can become healthy by just eating the healthiest food, moving their body, nobody has to fast. But what we can appreciate, if we really want to revolutionize healthcare, that there is profound metabolic significance in a fasting space, giving the body the ability to naturally burn up blood sugar. Think of the problems that we have in our society with type 2 diabetes. I was reviewing CDC data the other day. It's like 78% of people 65 and older are either pre-diabetic or diabetic. And so, you know, all of us, regardless of where we are at on some sort of political spectrum or opinions about healthcare, we all are facing the same issues with our physical health. We're either trying to deal with a blood sugar problem or keep ourselves from having to deal with it. So here's a fasting space where the whole thing is about burning blood sugar. And we can burn blood sugar naturally through this practice without any medication, without any cost. This is what our healthcare system really needs. Solutions that any person can learn to do, that are simple to understand, and that we can help each other to practice, to promote better health without any cost, and in fact, saving cost. So let's all focus on bringing health to ourselves first. And as we do that, I think what we'll come to find is that we are experiencing greater health in our society, and we will see that the intensity of our division and the problems in our healthcare system diminish. Think what the healthcare system looks like when less people are sick, when more people are able to function without needing so much healthcare. What will our hospitals be overloaded and medical providers burned out when more of our patients, a greater fraction of the time, is going to take the pressure off the system. So let's all focus on these things that we can control with our own personal selves. We'll move forward together, one step at a time. I'll look forward to connecting with you about some of these thoughts. I'm live streaming every week. I'd love to connect with you live. Send me a note, and I'll look forward to chatting with you about these things soon.